The Shannon Sinn Féin TD Donna McGettigan is chairing a public meeting in Clare this evening on the delivery of emergency healthcare services, bringing together politicians, healthcare experts, frontline workers and patients. It'll take place, as I say, this evening in the Templegate Hotel here in Ennis, starting from 7 p.m. And I spoke about the meeting and general issues around emergency healthcare services in the Midwest with Donna earlier. Good morning to you, Donna.
Morning, Alan. Good morning to the listeners.
Tell us about this public meeting that you're chairing this evening on emergency healthcare services in the Midwest. Why is this meeting happening right now?
Well, it's happening right now because I kind of felt that after the whole HICWA report and us leaders us elected reps, we all signed a letter stating that A, B and C should be happening. And I feel that things have gone quiet. So I need to revive this. We need to keep this alive in people's minds, and we need to keep going with it, and we need to keep fighting for it. So I'm calling this public meeting to get people to come along, to have their say on what we should be doing. I know what we're doing. We're putting pressure on the government at all stages that we can. But even recently, in light of Patrick O'Donovan calling us to stop volunteering or pitting potential sites, that's not good to hear, that kind of talk coming from government ministers when it's something that we feel we have every right to do. We need to have potential sites. We need to have sites that are going to be put in place, and we also need to see it put in Clare. That's what we've been calling for in Clare.
And as part of that feeling of needing to expedite this process as much as can be done, why you're highlighting some of the statistics, including that 12,000 people from Clare attended the emergency department in Galway over the past 3 years, which I guess tells us a lot.
Well, but that's the thing. These are figures that are going out, and I don't even know are they being taken into the account that 12,000 people feel the need to have to go to another country or county because they can't get the emergency services they need in their own area. And that's shocking, those figures, to see that that's happening. But we also have people that are afraid to go into A&E, and these people need to be heard. You're not going to get those figures, but they need to be heard somewhere along the line that is a reality. This is not scaremongering. We have people genuinely telling us that they are afraid to go in there, and that should never be a case. You should be told if you're going into hospital, that means that you need that care, and that means that you're going into the right place, and people don't feel that. So we'll have Melanie Cleary, and she'll be talking about how this has affected her on the sad loss of her daughter. And we'll also have Sinead Madden, who has created a study on the Model 4 hospital. And we will have our MEP, Kathleen Funchion, so she might give us a perspective on the European side of it.
Yeah, maybe tell us a little bit more about the fact that you have Sinead Madden there, who's the author of the Mid-Care Studies. How important is independent data in this debate?
We have great data coming out of. There has been the two great campaign groups in Clare that have been working on this for a long time. And the data shows that Clare is the obvious place for this. That's the clear data shows that. So Sinead will give her study. She'll let you know that Clare is the place for this. She's calling for a Model 4. We have a Model 3 in our manifesto. If we get the Model 4, that'll be absolutely fantastic. But the data needs to get out there that Clare is the place for this, and as close to Ennis as possible. It can't be, when you talk about the options, so you talk about option B, which is as close to UL as possible, and option C then is a hospital. So people are saying that option B could turn into option C, and this is sending out a lot of confusing messages then. So if option B turns into C, that means that it's close to Limerick than it is to us in Ennis, and it will mean that those out in the west will be left behind again.
And that was what I was going to ask you, was if the second hospital, the new hospital, ends up in Limerick, whether people in Clare will feel, well, look, we still have to travel, but at least, with a second Model 3 hospital there, we should be able to get through the emergency department quicker than just the sole ED in UHL? Or will they still look at it and say, well, I'm living in Kilkee or Kilrush or wherever it might be, and depending on the seriousness of my ailment, that is just not good enough for me. I would prefer it to be in Clare.
Well, that's the thing. If you have people out in Carrigaholt, they're over 100 kilometres away at the minute. It's not really going to bring them any closer. We also have issues with the under-resourcement of our National Ambulance Service. So we have that issue there. So you might be able to get closer to a hospital, but you also need the services of the ambulance to be able to pick you up in that timely manner and bring you to there. It has to be, the people are calling for it to be in Clare as close as Ennis as possible, and that voice needs to be heard, and it needs to be heard loud and clear. And if it means we have to go out and push for emergency planning and procurement, we have to hold our own Midwest TDs and senators to account to push for this, well then that's what we have to do.
Minister Carol McNeill had initially said options A and B would be pursued, with option C, the development of a new Model 3 hospital with an emergency department in the region, was a live option. And then later on, following a meeting with Clare's Oireachtas members, said that the development of a new hospital with an ED would be progressed in conjunction with the other approved measures. Do you take heart from that wherever, no matter about the location of a Model 3 hospital, that the process is going to be pursued and sooner rather than later, than if it was solely a live option?
Yeah, but there's no time frame around that. This option C could still be many, many years away, whereas she did, in fairness, say that she would be looking around emergency planning and procurement if that can be done, and that's the angle we need to be pushing on that. It does need to be done, option C, but she has also said that option B could end up being option C. So, that's kind of given me a clear indication that option B will be in Limerick and it'll end up being option C. So, and I think the main crux of this issue is that even our own health spokesperson, David Culnan, said the logical place for option C is in Ennis, close in Clare.
In the right here and now, though, and obviously a Model 3 hospital is some way away as of yet. What is your feeling about it, Donna? Do you think it is more likely to be in Limerick than anywhere in Clare at this point?
At this point, that's the feeling I'm getting, and I'm kind of concerned about that, and that's another reason for this meeting. I feel that unless we keep going with this, and I know that the two campaign groups are doing great work on this as well, but we just need to keep fighting for this. I really do believe that we have to keep going with it, get it into Clare. I mean, if you look at the option A, which is already in process, so that's the 96 beds that have just been delivered. It's going to be 2029 before the next 96 block bed is going to be delivered. And we've seen already the trolley numbers are going back up again. So, that had a short-term effect on the trolley numbers, the new 96. So what are we going to be facing into? We really do need to push for this emergency plan, and we really do need for the here and now, and we really do need people in West Clare to have proper health service in a timely manner.
Wherever this Model 3 hospital ends up, you mentioned that there's no time frame for it. We don't know when the work will begin, but also once the work begins, how long it will take to complete. Time frames of 10 to 15 years have been mentioned, which when you look at the situation now, and that's if it were to be delivered on time, seems an incredibly long way away for those who have had trouble getting the emergency care they need in a timely fashion. Having to wait potentially up to a decade and a half or longer, it must depress some people hearing that.
It does, and it's very, very concerning to hear that. And when you look at other public buildings around and the length of time it's taken, but this is where having sites ticked would be helpful, and having the emergency planning and procurement process put in place would be helpful. That would help speed up the process. It will still take years, but that if you see that happening on the ground, well then people will have hope, and it'll give them faith that something is happening for them and that they're not being left behind once again.
So what can people expect from this evening's public meeting?
So what we can expect is to hear where we stand, where myself, Morris Quinlivan, our TD in Limerick, who's constantly been pushing this, where we stand in this, where we are at the moment, where we hope to go, and what we want to hear from the people as well, what they want us to do. Now, we are pushing as much as we can. We are bringing it up every chance that we get. I even used it in my maiden speech to push for this. But we need the people behind us as well as our voices calling for this.
Why is it important, Donna, that the patients and families speak directly about their experiences? And what role do you think that public pressure can play in influencing healthcare policy, and when and how quickly that policy happens?
Well, when you look at the stats and figures, and people, even if you look at the trolley numbers now, people are coming desensitised to those facts and figures, and they're hearing them every day. And that's a sad reality in this country, that we're becoming so desensitised to the numbers coming out that we don't hardly even think about them. But when you start hearing the personal stories, then you hear the reality on the ground, that this is what's happening. And you might hear people that have had issues with this, that have never had their voice heard before. And it's very important for people to hear that, because it humanises the whole thing. And it takes away from the amount of work that is there on the stats. It has been phenomenal and is fantastic, but people are definitely becoming desensitised to them.
If the government doesn't act on all three options, A, B and C, as you touched on earlier, Donna, the potential possibility for option B to just turn into C, what are the real risks for Clare and the rest of the Midwest?
Well, the real risks are that we are going to see more deaths happening, and that's a reality, because there is still people outside that golden circle, if that is the case. And, you know, even if you look at in emergency healthcare, we spoke in the Dáil recently that in the whole of the Midwest, we're the only area that doesn't even have a clinical assessment nurse for mental health. And that's shocking. That's in the whole of the Midwest. So services in the Midwest are lower than anywhere else when you look at all other issues. So we need to be kind of pushing for this. And people of the Midwest matter as much as anywhere else. And, you know, why should they be left behind?
Shannon, Sinn Féin TD, Donna McGettigan, thank you for joining us on this on Morning Focus.
Thanks, Alan.